Kinship care is where a grandparent, aunt, uncle, brother, sister takes on the care of a child because their parents aren't able to do so. Kinship care has come to the forefront over the last number of years, more so because of the support needs and the number of kinship cares that are actually occurring across the country. Estimated at approximately around 200,000 kinship care arrangements in the UK. This happens for a variety of reasons. It can be through just the death of a parent, but it can also be due to mental health issues, other illnesses, or unfortunately drug and alcohol issues, which unfortunately takes up around 60 to 70% of the cases in kinship care. But kinship care does not have a demographic. It can cover anyone from £100,000 a year to someone on benefits. It can affect anybody, and it's something that we all need to think about in terms of the kind of support and how we bring these children up for the future. Kinship families face a number of difficulties when caring for a child in kinship care. The main focus when all children are placed is to really focus on making sure that the child's needs are met, so that they can thrive and work forward to the future. The problem is in doing this that we also need to then care for the people who look after these children, who often present with a number of different challenges. As a result, it is important then that we care for the carers and support those carers to care for those children to ensure that they can thrive. And in doing so, these kinship carers face a number of challenges in themselves. This relates to anything from isolation, because they can no longer have their own kind of group of friends that they might have socialised with. Many of them are pensioners who are retirement age and enjoying life and have had their children and now feel that it's time for them, and this no longer can happen. They also then have the stigma and guilt, particularly if there's a drug or alcohol issue, or even if it's a death of a parent. There's also this issue around opportunity for bereavement, or, as I say, anger, guilt because of how their own children have treated their grandchildren. And that in itself requires a lot of support. Kinship families need a variety of support in order for the kinship carers to care for the children to the best of their ability and for the children to thrive. Particularly with regards to the children in kinship care arrangements, many of them unfortunately have faced trauma, abuse, neglect at a very early age, and as a result will present with a number of emotional issues which really need supported as they grow. This can range from, unfortunately, and present itself in ways such as anger, aggression, hiding themselves away, lying, and carers need support in caring for that, and the children need support in terms of just how to address that and take that forward. They also have issues in terms of friends and peer networks, and for many kids are actually removed from the areas that they were brought up in. They're maybe moving to different local authorities, different parts of the country. The friends that they may have had before have now gone, and so it's really important that kinship care children have an opportunity to thrive and make friendships with other young people. Not necessarily ones in kinship care, but it is important that they kind of have those networks for them for support. Other areas as well, within even in school situations, unfortunately some of these children will show signs of issues within school, struggling to listen, concerns around ADHD, or just not really wanting to pay attention, not wanting to be in school. And unfortunately many teachers and things see children as badly behaved rather than actually fully understand the issues that these children face. So a lot of issues and a lot of concerns need to be addressed in supporting those children, and this is particularly so then in terms of supporting the kinship carers to support these children. The carers themselves need to be supported, their isolation needs to be addressed, so linking them into support groups, meeting other carers who have been in these situations, getting to learn what the kind of things and hints and tips that they can take to support the children, linking them into community services, what's available, because there is a lot of support out there for kinship carers, but they actually don't realise that that support is for kinship carers, particularly when they see a sign saying parents. Other areas in terms of information, training, teaching them how to, or helping them understand how best to support these children, to gain a better understanding of the different things that these children have gone through and how that's impacted, and providing them with practical hints and tips of how to address these situations, and also just to take care of themselves and make sure that they are getting the support that they need and have a time out and some respite for themselves, just to kind of maybe go back to that feeling of, that they are grandparents or aunts and uncles and they do need that time themselves. So it's very, very important that we support that family, entirely as a whole, and kind of work with the family, not just individually but together, to ensure that there's better communication, there's better understanding of needs, and there's a better way that we can support and they can support each other going forward.